I want you to pause everything because what I am about to share could transform every single morning you wake up for the rest of your life. Today, we are focusing on something almost every senior misunderstands completely. Not your primary care doctor, not your specialist, and certainly not the mattress salesperson ever explained this fully. The topic is how you sleep, not just how long, but the precise position your body maintains during rest. After the age of 60, this position can either quietly repair your body or gradually harm it. Most people have no idea which is happening to them. Here is a truth rarely discussed in conventional medicine. Research from the University of Rochester Medical Center revealed that the brain's glymphatic system, essentially its internal waste clearance network, is up to 60% more active during sleep than while awake. Think of it like a nightly cleaning crew that clears toxic proteins while you rest. The sleep position you adopt directly affects how efficiently this cleaning system functions. After 70, the brain's ability to remove a toxic protein called amyloid beta, strongly linked to Alzheimer's disease, declines significantly. Sleeping in the wrong posture accelerates that decline. I will reveal the single worst position seniors sleep in, but first, let's discuss position number 2, which involves heart health. Findings from Johns Hopkins are striking. Before we continue, consider this. Are you over 62 or even 84? Do you wake up stiff, in pain, or feeling unrested? Your responses help tailor this content to serve you better. Now the 4 worst sleeping positions for seniors, starting from number 4 to the most dangerous. The first one to avoid is lying flat on your back without support under your knees. Many have been told that back sleeping is the medically correct method. While that may hold true for younger adults after 60, a study in the journal Spine showed that adults over 65 who sleep flat without knee support experience up to 40% more lumbar compression overnight compared to properly supported positions. Consider your lower spine like a suspension bridge. When lying flat, the natural inward curve in your lower back, known as the lumbar lordosis, flattens against the mattress. Each disc bears uneven pressure throughout the night. By morning, discs become inflamed, surrounding muscles tighten, and nerve roots are irritated for 6 to 8 hours. Margaret, 71, from Boca Raton, Florida, had slept flat for 40 years. She suffered severe sciatic pain that prevented her from walking to her mailbox without stopping twice. She tried injections, physical therapy, and anti-inflammatories. When asked about her sleep position, she seemed confused. We made a single adjustment, a wedge pillow under her knees to restore the lumbar curve. Within 3 weeks, her morning pain dropped by more than half. This works because restoring the natural curve reduces compressive load on the discs and allows the intervertebral fluid, the shock-absorbing gel inside each disc, to redistribute overnight. After 65, discs have lost up to 30% of their hydration compared to young adulthood, making this nightly redistribution crucial. The third worst position is sleeping on your stomach. Seniors need to be cautious with prone or face-down sleeping. It forces the neck into a rotated position for hours. Research from the American Academy of Orthopedic Surgeons found this posture produces up to 3 times the normal mechanical stress on cervical vertebrae and discs. After 65, cartilage cushioning those joints has thinned, and neck muscles, especially the deep cervical flexors, have lost significant tone due to sarcopenia, the age-related muscle loss accelerating after 70. Sleeping on your stomach flattens the thoracic spine and compresses the ribcage, which limits diaphragmatic breathing. Your diaphragm, the main engine of your breathing, cannot fully descend when pressed against the mattress all night. This leads to shallower breaths, lowering oxygen delivery to your brain and every organ. Research from the Respiratory Research Journal shows that seniors in positions restricting breathing have lower overnight oxygen saturation and spend less time in deep restorative sleep stages, which are essential for cellular repair, hormone regulation, and immune function. I treated Harold, 77, from Scottsdale, Arizona, who had been a lifelong stomach sleeper. He experienced daily morning headaches, neck stiffness lasting until noon, and early signs of cervical disc degeneration. Transitioning him to a body pillow system removed him from stomach sleeping, and within 6 weeks, his headaches vanished. Follow-up imaging showed reduced inflammation in the cervical soft tissue. The second worst position is sleeping on your right side, which surprises most people. Research from Johns Hopkins shows that lying on the right side directs the full body weight, often 150 to 200 pounds or more, onto the right lung and compresses the vena cava, the large vein that returns deoxygenated blood to the right heart. Younger adults with strong hearts compensate effectively, but after 65, cardiac output has usually declined by 20 to 30% from its peak. The heart works harder with less reserve, and right-side sleeping adds mechanical pressure, further reducing efficiency. Additionally, the stomach sits slightly left of center. On the right side, the lower esophageal sphincter opens in a way that increases acid reflux. A study in the Journal of Clinical Gastroenterology found right-side sleeping increased acid exposure in the esophagus by over 70% compared to left-side sleeping. After 65, the esophageal sphincter naturally loses tone, explaining the prevalence of GERD in seniors. Dorothy, 68, from Nashville, Tennessee, had been on prescription acid-suppressing medication for 11 years. Her doctor had never asked about sleep position. After switching to left-side sleeping with proper pillow support, she worked with her doctor to reduce medication within 2 months. Gravity on the left side helps keep stomach contents where they belong. The number one worst position for seniors is sleeping in a fully reclined chair or wedge without proper head and neck alignment. Over the past decade, recliners, adjustable bed bases, and wedges have become popular, and many seniors now sleep semi-upright. Elevation itself can be useful for certain conditions, but head and neck position is almost always the problem. In a standard recliner or improperly adjusted wedge, the head falls forward, the chin drops toward the chest, and the airway is partially blocked throughout the night. Research from the American Academy of Sleep Medicine found that chin-to-chest positioning can reduce airway diameter by up to 35%. Over 50% of adults over 65 have some form of sleep-disordered breathing, most undiagnosed. This partial obstruction deprives the brain of oxygen in repeated microepisodes. Each episode triggers the stress response, floods the system with cortisol, fragments sleep, and prevents reaching deep slow-wave stages where human growth hormone is released, cellular repair occurs, and the immune system performs its critical overnight maintenance. After 75, the ability to reach and maintain deep sleep can drop by up to 35%, even under ideal conditions. Sleeping in a poorly aligned reclined position accelerates that decline significantly. Robert, 80, from Portland, Oregon, had been sleeping in his recliner for 3 years after his wife passed because it was easier to get in and out of than his bed. Despite 9 hours of sleep, he arrived exhausted. His memory was slipping, his blood pressure had become erratic, and his cardiologist considered adjusting his medications. A full sleep assessment revealed Robert spent almost no time in restorative deep sleep, with his airway partially blocked each night. We worked with an occupational therapist to transition him back into a properly supported bed using a cervical pillow and a knee wedge. Within 8 weeks, his energy was transformed, and his blood pressure stabilized. His daughter called in tears, saying her father was fully present and engaged in ways she had not seen for years. Now, let us discuss 4 better positions seniors should try. The first is left side sleeping with a pillow between the knees. This is arguably the single best position for most seniors. Left side sleeping helps gravity clear stomach acid, reduces pressure on the vena cava, supports cardiac efficiency, and with a standard or contoured knee pillow, restores neutral hip and spinal alignment, dramatically lowering lumbar and hip compression overnight. The second better position is back sleeping with proper knee elevation and cervical support. If back sleeping is most comfortable, placing a firm wedge or folded blanket under the knees restores the lumbar curve. Using a cervical contour pillow cradles the neck's natural curve instead of flattening it. This combination reduces spinal compression, supports neutral alignment, and allows the glymphatic system to perform nightly brain cleaning at maximum efficiency. The third position is slightly elevated left side sleeping using a wedge. For seniors with acid reflux, heart conditions, or breathing difficulties, elevating the torso 4 to 6 inches while maintaining left side positioning is one of the most evidence-backed interventions. Studies show it reduces nighttime reflux by over 75%, improves oxygen saturation, and lowers the number of awakenings caused by reflux or breathing disruption. The fourth better position is supported side sleeping with a full-body pillow. A pillow extending from head to ankles creates an external support system that keeps spine, hips, shoulders, and knees aligned, even during movement. This is especially valuable for seniors with hip replacements, shoulder arthritis, or spinal stenosis, as it prevents unconscious rolling and twisting that cause joint compression and pain. Many patients over 70 describe this as the most impactful sleep change they have ever made. Morning pain, fatigue, and brain fog are often accepted as inevitable after 70, but that is not the whole truth. How you position yourself tonight affects inflammation in your joints, the brain's nightly detoxification, and the efficiency of your heart. Even at 65, 75, or 85, the body retains a remarkable ability to heal, restore, and function, preserving independence, joy, and life quality. Making informed choices about sleep position can shift your health trajectory within weeks. One consistent change can begin improving energy, clarity, and physical function. You deserve mornings where your body feels restored. Share this information with someone over 60. Choose your sleep position wisely tonight and take control of your health. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.